have chosen to watch this video since you are interested in going ahead. Before I actually start, let me introduce. I am Dr. Girish Deshmukh, currently working as a medical director in a multi-specialty 300-bedded tertiary care teaching hospital in a metro city, that is Pune. Overall, I have experience of 22 years. I have worked across state government health services, central government health services in public, private sector, and now I have settled doing this medical director at a tertiary care hospital. So today let me introduce you to a certificate course in hospital safety management, which Astron offers you. See, mind you, this is a very huge topic, and to cover it within 10 minutes will be a little difficult thing, but then let us begin. See, healthcare is a system which is a set of subsystems which are interrelated and interdependent. It's a complex rather than linear relation. So any isolated change anywhere, it will affect the other system. Isolated change cannot be there. What do you understand by hospital safety? See, healthcare is the risk and uncertainties are inevitable in healthcare organization because of the human nature of it or the provision of intricate and multifaceted care. As I said, this is a highly complex system. So, what do you understand by risk? Risk or hazard? It's an unknown and unpredictable phenomenon that causes an event to result one way rather than the other. That is what was not expected. So, risk management. Risk management in healthcare comprises the clinical and administrative systems. Again, there is a method in place. Like you need to detect the risk or the hazard, then you need to assess, monitor, mitigate, and then prevent it from happening again. All hazards are potential risks to everyone, and everything in a healthcare organization can lead to accidental injury, financial loss, or loss of goodwill. So, deployment of healthcare risk management earlier was traditionally focused on the important role of patient safety and the reduction of medical errors that would jeopardize an organization's ability to achieve its mission and protect against financial liability. But, my dear friends, with the expanding role of healthcare technologies, increasing cybersecurity concerns, stringent statutory requirement, and the fast pace of medical science, and obviously the industry is ever changing, what I tend to call is pest analysis, or you can also call it ever changing PESTLE analysis. What do I mean by PESTLE? PESTLE is political, economical, social, technological, legal, and on top of above, ethical. So these ever-changing pest, what I call, this also has asked us to manage the risk, not traditionally, but we need to keep ourselves updated. So there are 8 domains uh, under which the healthcare risk management can be done. Few of them they are externally driven and few of them they are internally driven. So let me address what externally driven risk domains are there. To begin with, there are obviously strategic risks, that is we I'm afraid, but then the competition is there, so we need to keep ourselves at par. Industry, as I mentioned, pest analysis is ever changing, and the consumer demand, the clientele these days is very aware. Next is hazard risk. Hazard, I'll try to cover the hazards separately, but then be it be natural events or be it be fire hazard or electricity hazard, I'll cover it later. Operational risk domain, like regulations or the organizational concern or the governing board, whatever operational issues are there in the organization. And obviously, there will be financial risks. These are externally driven. So, what are internally driven challenge risk domains? They are recruitment, or the supply chain has to be mentioned throughout, or the intellectual capital of that organization. That is how trained your staff is, research and development, whether you are into it. How is the cash flow, or what about the liquidity, or what all services you are offering to the clientele? These are internally driven. So the role of healthcare risk manager these days has evolved. So to know more about this, I think you'll have to join this course of certification hospital safety management. See, risk managers these days, they proactively need to identify the risks and estimate the potential consequences and upsides. So what they do, they develop a response plan in case if the risk becomes reality. On the flip side, it mitigates the organizational exposure, way they respond, and then they execute the containment plans where these adverse and unforeseen situations they transpire. As I mentioned, due to this dynamic and multifaceted nature of risk management in healthcare, the role is constantly evolving. Another thing which you need to do is a healthcare risk manager, he needs to communicate with the stakeholders. That is documenting part, be it be reporting on risk or other adverse circumstances, or creating processes and policies and procedures. What do you understand by all these three words? See, procedure is a set of instruction for completing a task. What is process? It is a series of tasks. And policies, obviously, we all understand guidelines. So these course which you'll be enrolling, this course will cover the minute details. And additionally, these days, the risk managers, they must continuously monitor the ever shifting landscape of the healthcare risk continuum. So, what is the significance? Why do we need to do this? Because it's a moral responsibility. The patient is admitted in our hospital or has come to our healthcare organization, so it becomes our moral imperative. Obviously, goes without saying that there are legal obligations, and during these turbulent times, there are increased chances of litigations. Of course, it does ensures the occupational safety for the employees who are working with you, and it will lead to a good patient and doctor relationship because we are addressing that poor quality service, and we are taking, that is, we are nipping it in the bud. Who all are at stake? Obviously, patients will be there, patients' relatives, that is, visitors will be there, staff, obviously, our employees, physical facilities, and as I mentioned, it will be a loss of branding or prestige or reputation or goodwill of the hospital. So, to give you an example, suppose if a patient, what is the risk? A patient, suppose let's say he has a patient fall. Now, what is the scope? The patient generally falls in a geriatric age group. What is the nature? As I mentioned, is it a strategic hazard, operational or financial? Obviously, this comes under operational. I'm just giving you an example. What is the quantification? The significance is very high. The patient has come to you for some other comorbidity, but then in the hospital, he had a fall. So it is of high significance. Risk appetite. Appetite is obviously the loss of the reputation which the organization has to undergo. What is the treatment of this risk? Supervision of patients. It's as simple as that. And what potential? How will you be able to address this? We need to have this adjustable beds or the grab rails with the beds. So this just I give you an example. So about what all hazards are there? There are too many of them. I'll just quickly enlist. One is, as I mentioned, fire. The fire could be because of the fire could be because of inflammable, combustible, or electrical reasons, or the gases which there are in the healthcare organization. What do you do? There has to be a system in place. Prevention of fire, early detection, containment of the fire, or in case if the fire has already taken place, evacuation. Another hazard is electricity. We all know electricity is could be a static electricity, could be shock, or could be um, due to electrolyte imbalance. What are the control measures? The working knowledge of appliances should be good. Electrical safety measures should be there in place. Earthing and grounding. Grounding. I'm afraid not many hospitals are abiding by these earthing rules or the policies what are there in place. So we need to ensure that the cath labs or the major equipments what your organization has, they have been earthed. Waste generated, it obviously goes without saying that it has the potential for spreading infection, be it be general waste or be it be biomedical waste. So, what are the control measures in these cases? Segregation, transportation, storage, and disposal. A handler should use this personal protective equipments, and the waste handlers, they should be immunized. Mechanical hazards, poor maintenance of the equipment or the equipment failure. So, what are the control measures to address this mechanical hazard? Preventive maintenance of equipment and or periodic repairs on as required basis. Biological is, see, invasive procedures day in, day out, they happen in a healthcare organization, or at times the patient is on an immunosuppressant therapy, or a patient is susceptible. So, what are the control measures? Assessments should be done. If a patient is immunosuppressant, he should be isolated in order to prevent him from acquiring hospital-acquired infections. Regular surveillance should be there, or hospital infection control committee should be there in place. We also must discourage multi-dose vials, and bundle care should be there in place. There are chemical hazards as well in this organization. Chemical hazards, as in there are various chemicals, be it in lab or be it in housekeeping department or be it be for sterilization. So the control measures are proper care, storage, and use of these chemicals should be done. Then obviously there are clinical hazards. What are clinical hazards? For example, the look-alike or sound-alike drugs, or a verbal instruction was passed to a nurse in charge, and then she heard a different thing. So verbal instructions should be discouraged. We must never hurry the patient care activities. Another hazard is radiation hazard, which generally is in obviously in the Department of Radiology or Nuclear Medicine or Interventional Radiology. What are the control measures? Adequate shielding and the proper waste disposal. So security. Yeah, security again, this hazard is very important, like loss, theft, or for that matter, pilferage of smaller things like stationery, medicine, or linen, or other valuables. How do we address this? Accountability and CCTV surveillance. Explosion hazard. Explosion hazard generally happens in laundry, boiler, autoclave room, or even in OT. So, what all control measures can you take? You can make the OT flooring as conductive flooring using copper or aluminum strips embedded vertically in the floor so that all static electricity is discharged through the strips to the ground. So these are the hazards which I tried to cover, but then you will be able to learn this in a greater details when you actually join the course. So what are the administrative requirements? What is the organization supposed to do? Obviously, each organization, also the NABH says, they have to have a safety and health committee in place. There has to be a safety officer, and the resources should be given to this committee, be it be in terms of money, energy, effort, or time. Periodic inspections should be carried out. So data analytics, what this does is it embeds the organization to support decision making. It ensures the departmental cohesiveness. It prioritizes the risks and it allocates the resources on as required. So as I said, the risk managers, they need to proactively identify the risks and estimate the potential consequences and address it. So there are other key components of performing risk management in healthcare. See, understand this is a ever-shifting landscape of healthcare risk continuum. I'll just ensure the key components. Initially, what you need to do is you need to identify the risk. That is, you need to uncover threats and potentially compensatory events that otherwise would be hard to anticipate. Next is you need to quantify and prioritize the risk about the likelihood and the impact of occurrence. Then you need to investigate and report the sentinel events. Generally, the sentinel events, they are not reported. So what we can do is quick response to the event and thorough investigation should be done so that it addresses the immediate patient safety issues and it reduces the future risk. Next component is perform compliance reporting. See, there are day in, day out, we tend to hear there is a wrong site surgery done or wrong patient surgery done, but then this needs to be documented, coded, and reported so that it can be prevented in the future. Then another important component is we need to capture and learn from the near misses. What happens even if there is a near miss or a good catch because of maybe luckily, but then we need to address this so as this can be prevented in future. and best practices can be instituted in the organization. Another key component is we need to think beyond the obvious so that we can uncover the latent failures. See, active failures are obvious and are easily identified. But then what about the latent failures? They are hidden and they only will be uncovered through analysis and critical examination. How can you do that? You can do either by FMEA, what I call is failure mode effect analysis, or RCA, that is root cause analysis. So this course offers you a format of a risk management plan. Again, what management plan can be there? See, regular education and training of the employees. Generally, in our organization, we call it induction training. Whenever a new employee joins, so then this induction training. We need to have, as I said, patient public engagement should be there. The grievances of the patient, the response times, the staff responsibilities, accountability is very, very important. And the prescribed action, whatever corrective actions you have taken, they need to be articulated and they need to be communicated. So there should be a communication plan in place. Of course, even if everything is there in place, there has to have a contingency plan so as to address the adverse system or wide failures in order to avoid the catastrophic situations. The reporting protocol. Every healthcare organization must have a quick and easy to use system for documenting, classifying, and tracking possible risks and adverse events. So the response and mitigation plans, they have to be there. Again, as I said, it is a moral imperative to take every measure necessary to save lives. So the medical culture, it silently has taught that the ABC culture, what I call ABC culture, is accuse, blame, and criticize culture. This culture has to fade away. And rising in its place, there should be a safety culture emphasizing blameless reporting, successful systems, and knowledge, respect, confidentiality, and trust should be there. So, because this is a multifaceted care, rigorous risk management strategies are paramount in each and every healthcare organization. So, by establishing an ongoing and systematic approach to minimize the risks which are inherently associated with this field of healthcare, more and more healthcare organizations are successfully protecting the quality of care, and more the reason for individuals like us to enroll for this course so that we navigate through this tumultuous era of change. Mind you, in today's competitive world, employees are looking for the people who have distinct quality to offer to their functioning of the healthcare organization. So by enrolling for this course, you'll be able to inculcate new things and advanced concepts that will give you the ability to face the challenges with a more tactical approach. You'll definitely, I'm sure, will get a perspective towards risk management, which obviously will set you apart from others by offering you a larger array of benefits. So I hope I'm able to convince you the importance of this course, especially in these era. So if I may go ahead and request you for enrolling for this certification course in hospital safety management, which Astron offers you. Thank you so very much.